Thank you all for having me. I've been watching a lot of these faculty forums for so long. It's great to finally be able to contribute to one of the faculty forums. And as Scott mentioned, Khalid Osman, I'm a professor in civil and environmental engineering. My lab really focuses on how do we operationalize equity when we're thinking about infrastructure services and the provision of infrastructure services. And so I usually ask my lab to help me come up with cool titles. They're younger than I am, and so they have more catchy titles. And this is what they came up with for this presentation. And so let me take you on this journey of what a water provider, a community-based organization, and a researcher would be talking about in an informal setting. And so I want to start with asking a question to the crowd by just show of hands. How many people believe the water in their home that comes out of their tap or their bathtub or their sink in their bathroom is safe? Okay. And then if I was to ask you the question a different way, is that water clean? How many of you would raise your hand? Amazing. And it's not surprising, right? And I would love to talk to a few of you afterwards to see what metrics you're using to assess whether that water is safe or clean, or whether you're just trusting it because it comes out clear. But I'm not surprised. In a country like the United States, where we have 99% access, over 99% access to water, and over 87% of access to piped water, it's not surprising to see a room full of people who would raise their hands. And so the metrics that are used here in the US for regulating water, you have two types of standards: primary drinking standards and secondary standards. And this was established by the Safe Drinking Water Act. Primary standards mostly focus on things that affect your health. So like if you were to ingest this water, would it cause you to have a stomachache, diarrhea? If you were to take lead, for example, which is one that's more and more common, that would be considered a primary health concern. On the other hand, we have what are secondary standards, things that affect aesthetics, taste, color, odor. However, secondary standards are not enforceable. So your state and local and federal regulators don't actually enforce. They set standards but don't enforce standards for secondary aesthetic issues with water. And so what happens when you have secondary aesthetic issues and water providers are not incentivized to actually solve those issues? What you're seeing on the screen is a picture from Flint, Michigan, where someone is using bottled water to clean chicken. And so can you imagine having to use bottled water for something like preparing your food every single day, every day of the year? And I'm sure some of you may be thinking, Flint, Michigan was 9 years ago, right? Things are better there. They've corrected their mistakes, et cetera. However, this article is from 6 weeks ago on October 28th, where this is still happening. And so now I want to bring us a little bit closer to home, right? Flint is, if I was to get on a flight to Detroit, it's about 4.5 hours. It's a little bit further away. But what about the city just right next door, East Palo Alto? And East Palo Alto residents are dealing with brown tap water, which is taking a toll on their health and their finances. And a reference point I want us all to keep in mind as we think about when people talk about the finances of having to purchase additional water in addition to what you're already paying in your water bill that's coming out of your tap, is that bottled water on a volumetric basis is 100 times more expensive than tap water. And so a lot of my research uses community-engaged research, and I love working with community partners to give us access to people who we otherwise would not have access to, and doing this in partnership in a way that actually informs their own advocacy. And so one of the groups we're working with here in East Palo Alto is Nuestra Casa. And Nuestra Casa did workshops on their own before I got involved as a researcher to sort of validate what was being said in those articles, right? How are residents experiencing tap water in their homes? And so what we sought to do as part of this study is really dig a little bit deeper, right? Think about, can humans be used as sensors for understanding when there's chronic insufficiencies in water systems that affect the broader community? And then can multiple data points, right? Can we scale multiple data points, things like surveys and sampling, water sampling, to actually create solutions that are long-lasting and would create solutions for these communities? And so East Palo Alto, as I mentioned, is about 1.8 miles away from Stanford. And it's a unique city where a city with a population of about 20,000 people is serviced by over 3 water providers, right? This is a unique situation. This is not very common. You have Palo Alto, Park Mutual, and O'Connor Tract, which focus on, or not focus on, sorry, but are using groundwater as their primary source for serving their communities. And then you have City of East Palo Alto in partnership with Veolia that uses Hetch Hetchy water to service water to their communities. What we're seeing here, though, is regardless of which water provider is providing water to this community, there's this consistent reporting of odor, smell, and taste. And when we look at the consumer confidence reports that every city is required to do, or every water provider is required to publish, we see that all of these water providers are publishing that their water meets all of the primary health contaminants that are required by law. However, what's not included in those consumer confidence reports are the aesthetic issues that I talked about. And so if I was to pose that question I did in the beginning again, would you consider this water safe by a show of hands? I don't see a single hand up. And would you consider this water clean? Again, I don't see a single hand go up. However, this is the water that residents in East Palo Alto are dealing with on a daily basis. And this is leading them to distrust their tap water, right? Obviously, I wouldn't trust that tap water either. But this is not just something that happens in East Palo Alto. As I started my presentation with Flint, this is common in communities of color and disadvantaged communities across the United States, whether it's in New Orleans when there's a saltwater intrusion, in Philadelphia, in Pittsburgh, in Detroit. Communities that are often have large concentrations of Latino or Hispanic populations, Black African American populations, or of lower income, have this extreme level of distrust in their tap water. And so we were trying to figure out why that is and if there's things that we can do to help them rectify that. But there is a challenge, right, that who is responsible for the water that comes out of the tap is kind of a gray area. The city or the water provider is responsible for your system up until the property line. And so they do testing at the treatment plant, right within the treatment plant, as soon as the water leaves the treatment plant, and then at several points along the network. And we have millions of miles of water networks across the US. However, once that water line reaches your property line, the city is no longer responsible. They've met their due. They've cleaned the water to those primary MCL standards, and everything after that is up to you. However, this creates this huge data gap where on the resident side, if you're not reading those consumer confidence reports, you actually don't know what is happening with your water before it gets to you, and so you assume that the city purposely put this bad water in your system. On the city side, you don't know or have access to every resident's tap water quality, and so you are also in this weird data gap, and I think that's where our research really tries to fill in the gap. It's to get cities and water providers to understand what's happening at the tap, and for people and residents who are experiencing this poor tap water, for them to understand what's happening before the water reaches them. And so our project, and I'm going to zoom in even further on a specific project that we're working on right now. We did the project in 3 parts. The first part is a background survey where we looked at demographics, water preferences and general observations, an initial survey to enroll households. And then we looked at how people were experiencing their water across time. We know that surveys are often a snapshot in time, but if we could ask residents 3 times a week for a 30-day period, how they're experiencing their water each time that they take the survey. And then if they're compelled to, they could also upload pictures, and those were those pictures you saw in the beginning. So those are actual pictures from community members 1.8 miles away from where we are today. And then to validate some of the perceptions of what people are reporting in these surveys, we also tested each household 4 times, once at the beginning of the study period and again at the end of the study period. And we tested for about 46 different contaminants and properties in the water, just to validate some of the perceptions to see if these things were matching, right? Are we good predictors of what's wrong with our water? And that's important data that we can use, and I'll talk about that a little bit later. And to continue talking about the project a little bit, we wanted to compare between the human observations and perceptions, which I talked about, but we also wanted to compare spatially, right? Are these water problems concentrated to one neighborhood, one building, or is it something that's happening across the entire city? And so we spread out our enrolled households. We enrolled 50 homes in East Palo Alto, and we spread them out amongst the 3 different water providers to see if these issues are persistent across. We also enrolled homes in Detroit to try and compare not only a small population of 20,000, but what happens in a large urban area where water distrust is predominant. And then one feedback we often get in research and also from water providers is that, water quality is seasonal, right? What's happening with your water in the winter may not be what's happening with your water at the tap in the summer. And so we wanted to test in both periods. So we did a 30-day period in the summer and also a 30-day period in the winter. The data that I'm presenting on today is only from East Palo Alto. The Detroit data, we have one more winter session to collect data coming up in February. And so the dominant trends that we see here are that most people are drinking bottled or filtered water or are not trusting that their water is safe. And for the people who are trusting that their water is safe, they're reporting that it has a metallic taste or that it has a chemical or plasticky taste or it's earthy and moldy. But they're drinking it because they're forced to. And I bring up this picture because one of the homes that I visited to collect a water sample, this is what the outside of her home looked like. She has 7 jugs of water, and the thing that she was most upset about was the cost of this 7 jugs of water that she's constantly having to refill has gone up 3 times since COVID. And so this is in addition to already being burdened with having to pay a water bill that may have also increased several times over. But then additionally, just to have drinking water, you're paying an additional amount to your water bill each month, and it's gone up 3 times since COVID. And more emerging patterns that we saw is that a lot of people are resorting to filtered and bottled water. You have people who are drinking the tap water because they have to. And then some folks were reporting that they're losing their hair as a result of the water, or they perceive to be losing their hair as a result of the water, or that they're receiving skin and body irritation as a result of the water that they're using. And so then this is the reason why they may be even using bottled water to do things like shower, which is, as you can imagine, not very good. And so we categorize folks into 2 groups. The first one being the trustful non-drinkers, folks who had said that they trust their water, however, they were still not drinking it. And then we had another group of people who were distrustful. However, they were still drinking the water because they couldn't afford to have any other alternatives. And so now I'm going to go into comparing the perceptions with the reality. And so here we see what the water is telling us. The water quality results from a home in East Palo Alto when we tested across 4 samples had exceedance in manganese. Manganese is known for discoloring the water. It's also known for ruining plumbing fixtures and laundry. It has a bitter and metallic taste. And so what we found in this house is that the person who was taking the survey 3 times a week also reported that their water was tasting metallic or that it was bitter, showing that we can maybe use humans as sensors for understanding what's happening with water at the tap, which was the original title of my talk. If you got the email, it was supposed to be Social Sensors of Water before the students changed that up for me. And we're seeing this trend similarly across other exceedances. So like here we have several exceedances of secondary MCLs for iron, where exceedances in iron mean that you have a rusty colored water. If you have like sediment in water, there's corrosion, or that it has this metallic taste. And we see that residents are also perceiving that to be happening as we're being shown in the water quality test. And then the one that is most common across all of the water providers, regardless of which one that you had, and across all of the samples and across all seasons in East Palo Alto, was this issue of having a ton of total dissolved solids in the water, which indicates that there's hardness or deposits. You have colored water, salty tasting. And all the residents not only reported this and knew that this was happening in their water, but they also decided, this is something that we need to take a picture of. And so here I show the pictures. And so what we're trying to do with this data, and this is a rich set of data, is really evaluate the predictive power of resident observations on contaminant exceedances. And why I want to do this is because putting a sensor on everyone's house is extremely expensive, or trying to put sensors on an entire pipe network when you have millions of pipe networks is also extremely expensive. I believe that a cheaper alternative would be to periodically test or periodically survey communities for how they're experiencing their water, and then taking those inputs very seriously. And so we're actually right now working on creating models for both the perception side to seeing how well they match the observations, but then also using the pictures, right, and creating visual models that may look at pictures. If you could upload a picture and it would tell you what contaminants may be in that water. That's something that we're testing right now and we're super excited about. And so to conclude, I bring us back to this picture, right, of how people in a community less than 2 miles away are experiencing water every single day. And it's not unique to East Palo Alto, but it's across cities across the US, because our water infrastructure is aging, it's old, and our regulatory environment is not one that tests for things like aesthetics and enforces things like aesthetics. And so at this point, we really hope that the data and knowledge that we produce not only benefits the community partners that we're working with in terms of advocating for themselves and advocating for changes and policy changes and regulatory changes in their own communities, but also seeing if we can use this data as a scalable way of measuring where chronic water failure may happen before it happens. None of this would have been possible without collaboration from our community partners. I don't think anyone would have let me as a researcher come into their house, ask them questions, have them upload pictures, and even test their water 4 times over the course of a year without really strong partnerships with our community partners and the trust that they've already built with the community. And so I wanted to definitely make sure I give them a shout out and thank them for all that they've done for our research program. And at this point, I'm more than happy to answer any questions that you may have.